My name is Dr. William, and I need to tell you something that most doctors will never bring up in a 12-minute office visit. There is a condition that causes your belly to pouch out, your lower back to ache, and your core to feel completely unreliable. And a huge number of people walking around right now have it without knowing it. It is called diastasis recti. And here is the part that will surprise you. Most people assume this only happens to women after having babies. Not true. Men get it. Women who've never been pregnant get it. Even younger adults can develop it. And if someone already told you the only way to fix it is surgery under general anesthesia, I want you to hear me out before you take another step, because that could be the most expensive and unnecessary decision you ever make for your own body. Here is what almost no one explains to you in a 12-minute office visit. Drop your age in the comments right now. I read every single one, and your age matters more with this condition than you might think. I will explain exactly why in just a moment. Now, let me walk you through what is actually happening inside your belly when diastasis develops, because once you understand the mechanism, everything else makes sense. Picture the front of your abdomen. You have two long bands of muscle running straight down the middle, one on the left side and one on the right. Most people call them the six-pack muscles. Between them, holding them together like a seam down the center of a jacket, runs a strip of tough connective tissue. In medical terms, it is called the linea alba, which simply means the white line. That white line is not muscle. It is the same material your tendons and ligaments are made of. Its entire job is to keep those two muscle bands pulled tightly toward each other so your belly wall stays firm and closed. Now, wrapped around all of that is a broad, flat layer of connective tissue called fascia. Think of fascia like a wide, flat sleeve that surrounds each muscle from the front and from the back. In the middle, all those layers come together and fuse into one strong seam. That seam is what gives your belly wall its structural integrity. But when that seam is weak, when the tissue is loose and slack instead of tight and springy, something goes wrong under pressure. The two muscle bands start to drift away from each other. A gap opens right down the center of your stomach. That gap is diastasis recti. So, what pulls that seam apart in the first place? The most common cause by far is pregnancy. Over 9 months, the uterus grows steadily and stretches everything in the belly, including that white line. If a woman's connective tissue was strong and elastic to begin with, then after the baby is born and the uterus returns to its normal size, those muscles pull back in and the white line gradually tightens up and closes on its own. But if that tissue was already loose and weak before the pregnancy, it stays stretched. It simply does not spring back. The gap can be small, about 2 centimeters, which is less than an inch, or it can be large, 4, 5, even 8 centimeters, which is more than 3 inches across. I want to be clear about something important. A small separation just above the belly button, roughly 1.5 to 2 centimeters after childbirth, is completely normal. It is often just a natural sign that a woman has given birth. That requires no treatment at all. That is biology working exactly as it should. Now, I want to give you something before we go further, because what I have shared so far, the anatomy, the mechanism, the range of what is normal, this is the foundation you need to make smart decisions about your own body. And this is exactly the kind of information that belongs in something I put together called the Complete Senior Health Vault. It covers the medications worth questioning, the foods that act as medicine, and a plain English guide to what happens inside your body after 70. You can find the link in the description or scan the code on your screen right now. The QR code will stay up in the corner as we go. And in just a few minutes, I'm going to tell you about the single most important thing you can do at home to start closing this gap without a surgeon. Now, let me tell you about the two biggest mistakes people make with diastasis, because these mistakes are everywhere and they are making things worse for people every single day. The first mistake is doing the wrong exercises. And this one catches people completely off guard because the exercises they think are helping are actually tearing the gap wider. If you have diastasis You must never do exercises that lift your torso off the floor or lift your legs off the floor while you are lying on your back. Here is why. When you lie flat and lift your upper body, or when you lift both legs off the ground, the pressure inside your abdomen rises sharply. Your belly pushes outward. And every time that internal pressure spikes, it puts force directly on that already weakened seam and pulls it further apart. The classic sit up and the classic crunch, the two moves that almost everyone associates with building a flat stomach, are the exact moves that make diastasis worse. If you have this condition, those exercises are completely off the table, not modified, not reduced, off the table entirely. The second mistake is rushing into surgery. When a woman has a visible separation, say 4, 5, or 8 centimeters, she is typically offered an operation to stitch the muscles back together. Often it is done as a minimally invasive procedure with small incisions, and sometimes a mesh is added to reinforce the repair. From the outside, it looks clean, it holds, it sounds like the problem is solved. But surgeons themselves have a saying, and they mean it seriously. The best operation is the one you never had. Let me tell you about someone I will call Donna, 7'4", from Columbus. Donna came to me after being told she had a 7 centimeter separation and that surgery was her only real option. She was already scheduled. She had the anesthesia consultation done, but before she went through with it, we talked. I asked her to try a specific approach for 30 days first. Targeted exercises, some nutritional support, and patience. 30 days later, her gap had closed enough that her surgeon agreed surgery was no longer necessary. Donna kept her appointment canceled and has not looked back. That kind of outcome is not a miracle. In my 15 years of practice, I have watched it happen again and again. Because here is the truth. In a large majority of cases, diastasis can be closed without surgery, and the effort required is not heroic. On one side of the scale, you have targeted exercise, nutritional support, and some patience. On the other side, you have general anesthesia, which is chemically switching the brain off and can affect memory and mood for weeks afterward. You have surgical risk, and you have scar tissue, which forms after every single operation and can pull and tighten the surrounding area for years to come. Before you put yourself on the surgical side of that scale, make every reasonable effort on the other side first. And here is the bonus. Everything you do to close the gap also makes your entire body stronger and healthier, not just your belly. If you have been watching this far and this is starting to sound relevant to your own situation, the code is still there on your screen. The vault goes deeper into exactly this kind of information. Now, I want to give you the deeper picture because diastasis is rarely just about the belly, and understanding this changes everything. When you have diastasis, you have weak connective tissue. That much is clear from the gap itself. But here is the part almost nobody explains. Weak connective tissue rarely sits in just one spot. It tends to show up throughout the body at the same time. Doctors call the underlying pattern connective tissue dysplasia. Think of it as your body building this tissue too loosely across the board, and it almost always travels with low vitamin D and shortages of key minerals, the raw materials the body needs to build strong, springy tissue in the first place. That is why weak connective tissue tends to come with a whole crowd of other issues. Varicose veins, those rope-like swollen veins in the legs, hemorrhoids, organs that sag out of their normal position inside the body. Stretch marks on the belly, the thighs, the back, a heart valve condition called mitral valve prolapse, where one of the valves is too floppy and does not close as tightly as it should. Trouble with vision, teeth, nails, and joints that crack or bend too far. All of it traces back to the same underlying issue, loose, weak connective tissue throughout the system. So when you spot diastasis, it is actually pointing you towards something bigger. It is your body sending a signal while there is still time to act. Start fixing the whole system, and you do not just close the gap in your belly, you strengthen your bones, your joints, your blood vessels, and your overall resilience. In a strange way, that gap is doing you a favor by showing itself. Now, age matters here more than most people realize. After 40, the body produces new collagen more slowly, and collagen is the protein that gives connective tissue its strength and its bounce. That means the same gap closes faster in a younger body and takes more patience in an older one. This is exactly why I asked you to drop your age in the comments. I genuinely want to see which age groups are watching because it shapes how quickly you should expect results and how I will build the next videos for you. Before we get to prevention, a quick note for women who have recently given birth. Since pregnancy is the most common cause of diastasis, and since we now know it is the weak connective tissue underneath that is really the issue, there is something practical you can do to support recovery in the months after delivery. Wearing a support band for the first 2 months after giving birth helps take some of the load off the stretch muscles and gives them time to draw back toward the center. From 2 months to 6 months, supportive firming garments serve a similar purpose. The reason is simple. The moment the uterus empties, the space inside the abdomen suddenly shrinks. But muscles that spent 9 months stretching outward cannot snap back in a single day. They need time and support while they gradually return to where they belong. Now, let me give you the most important practical tool in this entire video. The best exercise I know for closing diastasis. And the logic behind it is as simple as it gets. If you want your stomach pulled in, then pull your stomach in. That is the whole idea. Here is exactly how you do it. Pull your belly button back toward your spine as far as it will go. Hold it there. Do not let it release. Now, while holding that deep tension, begin pulsing. Short, sharp contractions, trying to draw the belly button in even further with each pulse. You can breathe out in small, short breaths between pulses, but in those brief pauses, you never let the belly wall relax. You keep that deep tension the entire time. You continue until the muscles begin to fatigue and cramp. That is the signal. That is when the real work is happening. Then, very slowly, you release. Even if you do this just once, at the intensity I am describing, you will feel your stomach tighten and pull in almost immediately. That is real. That is not a trick. Here is what it does to the gap. Those two muscle bands that drifted apart, leaving that window between them, get firmer and tighter each time you train them this way. They begin pulling back toward the center, bit by bit. That window narrows and closes. In my own practice, I have watched women who were scheduled for surgery with gaps of 7 or 8 centimeters work through this exercise consistently for a single month and come back with separations so much smaller that surgery was no longer on the table. Do this exercise at least once a day. If your gap is large and noticeable, do 3 to 4 sets a day, each one going until the muscles begin to cramp. That is where the fast results come from. And here is something I genuinely appreciate about this exercise. You do not need a mat, a gym, a specific time of day, or any equipment. You can do it lying down, sitting in a chair, standing at your kitchen counter, or walking around the block. You just pull your belly in and start the pulses. Anytime you remember it, you can do your body a favor right then and there. No matter how many times you have given birth, whether it was 1 child or 5, you can get your midsection into excellent shape. It comes down to the right exercises done with the right effort, and this is the one that moves the needle. Here is your takeaway as your doctor. If you have a gap, stop the crunches and sit-ups today. They are widening the separation, not closing it. Start the drawn exercise at least once daily. If the gap is large, 3 to 4 times daily until the muscles cramp. Get your vitamin D and mineral levels checked at your next appointment because the tissue needs those raw materials to rebuild. And treat this gap as a message about your whole body, not just a cosmetic concern. Fix the whole system. And in most cases, you will never need an operation. Please remember that what I share here is educational information meant to help you have better conversations with your own doctor. It is not a substitute for a personal medical evaluation. Never stop a medication on your own. Bring any changes to your physician. Your body is specific to you, and your doctor knows your full picture. Drop your age in the comments and tell me which part of this surprised you the most. I read every single one, and your responses genuinely shape what I cover next. I made a video that goes deeper into the nutritional side of connective tissue, specifically the vitamins and minerals that most people over 65 are quietly running low on, and that affect far more than just their belly. I will put it right here on the screen. Go watch that one.